Having given that basic introduction, allow me to speak a bit about now the health system shortfalls that we have in cancer care as a country. We have seen in the past that funding is one of the major issues that is affecting healthcare in Kenya. We have always oscillated between 4% to 6% of the national expenditure. The allocation that is dedicated towards healthcare hardly goes past 6%. Now, what this means is that we do not have enough funding to actually cater for various disease programs that we have. Now, having said that, we are looking to expand access to cancer care services, which are not available in all the counties. Today, we learned that we only have about 67 cancer care centers, and these cancer care centers are actually within just 19 counties only. Now, out of these 67 cancer care centers, we are talking about only 12 which are public and the rest are private. Now, even the ones that are private, only 5 of them can actually provide comprehensive and specialized cancer care. So this means that there is literally limited cancer service available for people in this country to utilize. The ranking that was produced by the Institute yesterday was that Nairobi, Nakuru, Kiambu counties, those are the counties with actually a lot of or several cancer cases. But what this means is that most of the cancer care centers are concentrated within these counties. So it means we are leaving behind other counties that are not reporting more of these cancer cases now. So what the approach that the country is taking is a reactive approach rather than a proactive approach, where we need to have these establishments done before we start reporting major cases of cancer in this country. So the other shortfall that we can actually count is the inadequacy among human resources. We do not have enough human resources, including the capacity for cancer care prevention and control. Today, if you look through the registry for KMA, you will realize that we have slightly above 100 oncologists in this country. Now, this is the number that is supposedly going to serve more than 54 million people in this country. So that means that one oncologist is supposed to serve nearly 540,000. So that is a huge ratio that the country cannot afford. So we still lack a lot of capacity development among human resources. And these are issues that result from the lack of funding in the health sector. We have also seen a general lack of public awareness and knowledge on cancer prevention and control. The reason I'm talking about this is because even though the Cancer Institute of Kenya is actually working to document even the cancer centers where we can get this screening, but how many people actually know about these centers? You will realize that 46% of all cancer diagnoses are done at really advanced stages where very minimal care can actually be done. So this means that we are not aware about the services, the preventive measures that are actually available. We are not aware of some certain risk factors and exposures that we experience from childhood through to adulthood that we can actually talk about and live through without getting exposed to these risk factors. So the general awareness among public is an issue. The few who actually have the information also are able to teach or to acknowledge and teach the rest of the public this. So this is why we are saying, as the young people, we need to spread the word, get informed, let us understand which are some of these behavioral risk factors that we are indulging in right now that is exposing us actually to cancers. So we can also talk about the limited cancer research that is available. We do not have enough research about cancer in this country. And this the research is what would inform policy that will then translate to how cancer services is spread in the country. So we need a lot of research in this area. A lot of learning institutions are doing this, but still at a very limited scale, and are unable to actually fully inform development of policies around this area. Also, a lot of young people are not getting enough recognition or even a voice at the decision-making table where we can actually talk about some of the risk factors that the youth are actually now exposing themselves to. Remember, we said earlier that between the age of 0 to 18, we only have 2% of cancers that are occurring. But if we extend this to 29 years of age, the percentage goes up to 25%. And that clearly tells you that just 9 years between 18, just around 12, between 18 to 29, you can see that the percentage explodes. And that means that we expose ourselves to a lot of these factors that cause cancer. So we are also talking about the lack of multi-sectoral coordination among other sectors. We have said in the past that cancer is not only a health sector issue. Cancer, we are supposed to involve all the sectors in this. And the reason we are saying this is that issues to do with unhealthy diet, these are issues that we can actually fix from the agricultural sector, from the trade industries, because we want to look at what kind of foods are we bringing into the country. So there is need to actually bring in all the sectors to address these shortfalls. And that is why we're saying if we treat cancer as a health sector problem, then it creates a whole broken system, because now we will only be focusing on treatment, but we cannot focus on prevention. We are saying things like unhealthy diet are issues that we can address basically from our own kitchen. And that is why we're saying, how do we resolve these health system shortfalls? Let us bring in all the sectors. Let us understand that cancer is not only a health issue, but an issue that we first can resolve individually based on our behaviors, based on the environmental exposure. And there's very minimal percentage that is caused by biological factors, just about 10%. So this means that over 90% of all cancers are caused just by behavioral and environmental factors. So this cannot only be in the health sector, but we need a multi-sectoral approach to actually address this. The other example that I want to give on how we can actually resolve these issues is expanding equity and universal coverage for health services. I remember we said earlier that the report that was released by the Cancer Institute yesterday indicated that we only have about 67 cancer centers in this country. These 67 cancer centers are spread within only 19 counties. What does this tell us? That out of the 47 counties that we have, then it means only 19 counties have this. So what happens to the rest of the people in other countries that require these services? So there is need to expand that so that everyone can actually access screening services when they need, cancer education when they need that, so that we are able to prevent this or get early diagnosis before advanced stages. Let us also talk about strengthening or accelerating oncology workforce development. We said earlier that we do not have enough health workforce to actually address cancer. If we go to different specialties within oncology, specialties like radiation oncologist, we have slightly above 16 of those. Oncology nurses, we have less than 50. therapy radiographers, nuclear medicine physicians, these are less than 5. So these are the specialties that we are missing as a country. If we are going to close the care gap, it means that we need to accelerate these training programs so that we can have more. As a country, we do not have, generally, we do not have a shortfall of healthcare workers. What we lack is specialties in these significant disease programs that we are looking to address. When we start addressing this from the funding, then to training healthcare workers, we will be able to have this on board so that we can increase the number of these healthcare workers. And how do we do this? There's need to engage local training institutions and international training partnerships where we can have our health workers trained and strengthen capacity development among them. Today, if you come to Amref International University, we have a program on oncology nursing that is actually attracting quite a number of students and in-service nurses that want to have this kind of specialty. So, but how many universities or how many mid-level colleges are doing this? There are very few, and the reason is because of the funding that is required to do that. And to have a better funding, it means that as a government or as a people, there is need to establish innovating financing mechanisms that can be used for cancer control. Now, how do we do this? Let us look at expanding the UHC package to cover cancer treatment. Everyone entirely in the African continent is talking about UHC. While every other country is at a different stage on this, there is quite a number of diseases programs that have actually been left out of UHC as a package. So we are asking for us to close this care gap. There is need to actually include cancer treatment within the UHC package so that the common mwananchi can actually access the services. We know how expensive cancer diagnosis, even treatment, can actually be. So without this, a lot of people just sit back because there's very minimal that they can do. So there's need to actually expand the UHC package. And also a lot of programs, a lot of reports that have been done in the past have recommended that as a country, we need to establish a cancer fund that would then pool funds for prevention of cancer and its control. So these are some of the financing mechanisms that we can actually adopt to close or nearly reduce the gap in cancer care. So remember we said earlier that we only have about 5 cancer centers which can actually offer comprehensive cancer treatments in this country. What this means is that the pricing is at the ceiling for treatment. So some issues or some issues that can actually be done or addressed so that we can have this resolved is that there is need for even introduction of a pricing policy that can actually regulate the cost of treatment. A lot of people cannot afford this. So when we have enough funding, then the government can actually come up with a policy just to regulate the pricing that actually happens, because a lot of people are not able to access these services because of the funding. We know that quite a number of Kenyans fly abroad, seek these services in other countries, when we can actually offer these services in this country. Now, the other way that we can try and resolve these shortfalls in the health system is proper coordination of partnerships and multi-sectoral collaborations that we have. Already there are a lot of stakeholders that are willing to contribute in fighting cancer in this country. There are a lot of facilities beginning from level 3 all the way to 6 that are offering these services. But what we do not have is proper coordination where we will have clear mandate or definition of roles and responsibilities at all levels of cancer care, so that you'd know that if you need screening, this is the facility to go to. If you need diagnosis, this is the kind of referral system that needs to happen. But we still do not have a proper functional referral system when it comes to cancer care. I know the Ministry of Health is implementing primary healthcare networks that is establishing a referral system where healthcare begins from the dispensary, then you can be able to be transferred to a higher level facility. But this is not functional for cancer treatment or cancer care. So these are some of the issues that we need to strengthen so that we can close the gap in care. Finally, I want to talk briefly about leadership and governance that comes with cancer care. There's strong need for accountability. And what this means is that we need to have a strong monitoring and evaluation framework where we can monitor the facilities that have been designated as cancer care centers. A lot of people do not even know these facilities. A lot of people do not even know which counties these facilities are available. So are these facilities doing enough to let or to create public awareness among people? Are we doing enough to show that these services are available? A lot of diagnoses that happen at advanced stage happen because people do not know where to get screened, where HPV vaccines are available. So there's need for strengthening leadership and governance in the health sector, especially to ensure that we get a multi-sectoral approach and inclusiveness in closing the cancer care gap. But now, what role can we play ourselves as an individual? What role can you play towards this? We have talked about issues that we can take as a country to resolve these shortfalls. But as a person, as a young person, what can you do to contribute towards closing this cancer care gap? As a young person, let's start by getting informed. Do we know much? What kind of information do we have about cancer as a young person? Are you able to differentiate some of the risk factors that we indulge in that increases our risk of acquiring cancer? I said earlier that behavioral and environmental risk factors contribute to about 90% of all cancers. Now, what this means that if we are aware of these factors, then it means that we can avoid this. Look at issues like tobacco use, which is responsible for about 30% of all cancers. Unhealthy diet, which is responsible for about 35% of all cancers. These are issues that we need to get informed about as a person, as a young person, then help educate other people about these risk factors. There are issues that we do not have control over as a person, which would be biological factors. And we have said this only causes slightly less than 10% of all cancers. So the major issue actually lies within behavioral factors and environmental factors. So as a person, as a young person, it is your responsibility to get informed about this and educate other people so that we can have the information out. We can create more awareness and knowledge about these risk factors. Another thing that we can do as a young person is advocate for people to get vaccinated. There is a HPV vaccine that is available, for example. Are we talking to our young girls about this? The vaccine is available for girls between the age of 9 and 14. But how many people know about this? Do we talk about this in our households? Do we talk about this in our schools? Do we talk about this in our places of work? Are we advising our girls appropriately about this? These are interventions, these are things that we can do as a young person. These are contributions that we can actually make at an individual level. We do not have or need to wait for the government to address all those issues that I have talked about earlier to actually get here. So some of the issues that we can take individually is one I said, let us get informed, let us get vaccinated, or advocate about this, tell the young girls about this, let's talk to our parents about this. A lot of households, this information might be missing in a lot of households, a lot of communities, but as a young person who is informed, are we spreading the word out there that this is actually available and would help us close this gap. And finally, getting screened. A lot of us, a lot of people, a lot of young people after the age of 18 who are not able to get vaccinated, with this opportunity of getting screened. I said the documented cancer centers do these services, especially from even level 3. So are you getting screened? We are saying that let us get screened regularly so that we can avoid issues of having diagnosis done at a way advanced stage when minimal care can actually be done. So as a person, these are 3 major issues that we can take head on so that we can actually help or contribute towards closing the cancer care gap. So one, I said, let us get informed about this and spread the word. Let us get vaccinated or talk about it, create awareness among our household, in schools, in our places of work, and then let us get regularly screened so that we can get help at an earlier stage. So allow me to say that the Kenya National Cancer Control Strategy has various key priority areas, actually 5, that help us understand where we can actually get different measures or strategies at each level. If you want to talk about prevention or early detection or screening, there's quite an elaborate mechanisms that has been highlighted by the Cancer Institute on how this is done. We are talking about cancer diagnosis. We have registration, the cancer registry, and even surveillance, mapping. So these are areas that, priority areas that the Institute has done so well on that we need to get ourselves informed about so that we can contribute at an individual level. So allow me to stop there so that we can open this to a discussion between amongst us and have other contribution from other people on how we can actually contribute as a person, as an individual, as a youth. How do you think that you can actually contribute towards the care gap? Or what are you seeing within your place of work, within your school, that is actually contributing to these behavioral factors or environment factors that you can actually do something about so that we can close the care gap? Over to you, Marion, at that point.
Thank you so much, Dr. Pon, for that very informative piece of information. And now I'd like to open up to our participants. In case you have any recommendations or questions, you're free to raise your hand or type them in the chat box so that we can continue this discussion. And even as we do so, maybe Dr. Pon, one thing I was keen on looking is our health information systems. We know health information is one of the key pillars for our health, to reinforce our health systems rather. So I'd like you to touch a bit on health information, particularly data and data surveillance across the continuum of cancer care.
Thank you, Mariam, for bringing that up. I think one of the key pillars of our health system is actually functional health information system. And this is why there is a lot of conversation on surveillance data, on the registry. As I said earlier, the government as it is right now, especially with the establishment of the Institute, there is a lot that has been done in that area. We now have a cancer registry. We have enrollment forms and even a facility preference for treatment that the Institute now has. What this does is that the Institute is able to track data from individuals, especially from screening or even those who are getting vaccinated, and even the diagnosis. And this is where we are able to get the data on late diagnosis that is happening. Remember, I said earlier that 46% of all cancer diagnoses are done at a way advanced stage when there's minimal care that can actually be done. So what this means is that the institute has been able to utilize the information system that we have to have this, but a lot is still not done. There's room for innovations in this. We need quite a comprehensive reporting in this, because we still lack a lot of information in this area, where we can actually talk about what is actually happening at household level, what is actually happening in the counties that we do not have cancer centers, what is happening there. So there's still a broad array of opportunities that the young people can actually tap into and come up with probably a digital innovation that touches on health information system that we can use to report these cases. Not all data is reported. Remember, for these estimations to happen, it means there was only a few samples that was done so that we can come up with these figures. So a lot is still missing out there. We are missing different county-specific scenarios, especially those that are assumed not to experience quite a number of cancer cases. Counties like Lamu, or if you look at the report that was released yesterday, there are very minimal cases that are being reported from those areas. And why are we saying that? Are we saying that we talked or we have household data that informed that? So we have quite a lot of opportunities in those areas that the young people can actually tap into, so that we have all the information reported at national level. Thank you.
Okay, thank you so much. I can see Mary Boniface, your hand is raised. Please go ahead.
Yeah, good afternoon, and thank you for the opportunity. I would like to make a comment towards the area of healthcare, or rather human resources for health. In terms of shortages in specialties, one to note is also that JKUAT recently introduced a master's course in oncology, and I've seen my colleagues, and especially the clinicians, enroll for that. And there is need to continue involving more institutions to mount similar courses so that we can continue training. Secondly, there's also been a trend by most of the county governments to employ health workers on contracts. And in my view, I feel like this kind of limits people to go back to specialties, because one of the issues when it comes to training is the cost. And most of the times when people are on short-term contracts, then it is less likely that they'll focus on going back to school to get specialized. So I think it's an area that we need to really talk about, the employer and especially the counties, to ensure that they get healthcare workers on permanent basis, so that there is the focus of people going back to school and getting these specialties, if we're really keen on, ensuring service delivery, and especially to the emerging issues. Again, the diversity of the counties, we are very far ends in the country where access is a challenge, and also numbers, and especially shortage. Then another thing we can focus is ensuring that the workers who are down there, the nurses and the clinic officers manning the health centers at the very far ends, the same institution could come up with short courses that can keep revamping the information, and especially on cancer and the emerging conditions. This will ensure that they're up to date with the guidelines, and of course they'll keep passing this information to their patients down there. Because if we focus on primary health care, then we all understand how promotion and preventive health care is key. Because again, if we really want to bring down these numbers, we need to focus on prevention, and prevention will start from awareness. So if then we don't talk to the people on the ground, they have no information and they would not know when to, seek guidance or care from the healthcare workers. So I think those are some of the things we can look into as we walk towards the direction of improving the healthcare for Kansas and generally Kenyans to continue getting these services. Thank you.
Thank you, Mary, for that. Sorry. Anyone with comments? You can feel free to raise your hand or even type it in the chat box so that we can be able to see. And I think one key thing that has also come out from Mary's comments is also the need to train community healthcare workers, especially those who are in touch with the people in the community. It's important that we offer them this education to disseminate this to their people also. Yeah, I'll give a chance to Dr. David Odhiambo. You can go ahead.
Thank you, Marion, and thank you, Shadrach, as well as Mary, in terms of the remarks that you've made. And I think to a greater extent, there's a great contribution in terms of how we as young people can contribute to this. And beyond just as young people contributing, we need to ask ourselves, what are the shortfalls and how have we been impacted? One key thing that I've noted, especially when you're looking at it from a health advocacy standpoint, we are all Kenyans in this particular forum where we are, I assume, based on the names that I'm seeing on the screen. And by virtue of being a Kenyan and being able to join this call, definitely you've seen a WhatsApp group somewhere, you've been contributing to particular causes where probably somebody is undergoing cancer treatment, or they need to be flown out of the country because of treatment needs. So that is a personal encounter that you have with that particular condition. So from that personal experience, the question you need to be asking yourself is, why is it that this person cannot get care without having to mobilize resources like any other person? Because at times you see, for example, if somebody is sick of malaria, how many people mobilize resources for malaria care? Most likely not. I don't think there's anyone who has ever mobilized resources to treat malaria in this particular forum. So why is it that for cancer, where we see there's a substantial need and there's a growing burden, we still have to fundraise and support people individually because there are shortfalls in our system? And that is where you need to start by asking questions. And I think that is an important thing for us to ask ourselves. How are we holding people who are responsible for the delivery of the services and delivering interventions accountable for the work they need to be doing? It's important to hold each other accountable. Then the other thing that I feel I just needed to mention at this particular moment is we are doing a lot of talking, we're doing a lot of advocacy in the different forums. Some of us are offering interventions wherever we are, but oftentimes we are busy and actually very quite eager to point fingers and hold people accountable without looking within ourselves. I remember today actually I had a call in the morning at around 11, a work-related call. One of the key discussion points was, we are talking about advocacy, we are creating awareness, we're building capability, but how many of these people we are training are actually doing the work that needs to be done? How many of the young people, probably, let's say, for example, those who are in this particular meeting room, are doing something about what these challenges are? We're talking about HPV vaccination, you know that they are available. Are you encouraging people even in your own family to go take up the vaccines? Dr. Pon mentioned it here in terms of the conversation. Are you taking it up as a personal responsibility and a personal initiative? Then when you do that, the other bit that we need to ask ourselves is, which facilities are offering these services? And just to speak it out here, level 3, 4, and 5 facilities, mostly the government facilities, are offering HPV vaccines free of charge. So if you know any lady who is within the age group 12 to 16 years, please encourage them to go to the government facilities. They'll just need to give the information, go for the first dose, and they'll be advised on when to go for the second dose of the vaccine. It makes it clear that we know how we are transitioning and actually ensuring most of this is happening. And it's critical that we also ask ourselves, how do we bring each other together? How do we work as consortiums, as individuals partnering with any other person to support one another? And that is why, from a agriculture standpoint, we have the Youth Voices Network, where we are hoping that as many young people who have an interest and are passionate about changing our healthcare system dynamics can come on board. We engage. You need guidance on how to intervene, how to design your solution. We work together. And in working together, agriculture would exist on its own on this end. But you, with the initiative that you're running, we're able to amplify the work you're doing, keep it giving you the lifeline you need to continue doing the work. And that lifeline helps ensure that a lady in a particular county, let's say Garissa, Siaya, is able to get the HP vaccination they needed. A parent who is sick of cancer in a county that doesn't have a cancer care facility is able to get care because we advocated and there's an activated referral pathway, such that when they went to the primary health facility in Siaya, then there was no cancer care facility in Siaya. They were referred to Moi Teaching and Referral in Eldoret, where they got the care they needed in a timely manner. But if that doesn't happen, then we are missing out. That particular kid who would have been vaccinated doesn't get vaccinated. The old mama or the old man from whichever county it is doesn't get the referral. Without them not getting the referral, somebody is losing a parent, a guardian, and a friend, probably, and even just a normal human being as a country, we're losing someone. How do we avoid those? I think the most critical bit that I wanted to highlight is that there are individuals behind the numbers. When you hear numbers about people who have lost life to cancer, the people who are being affected, these are individual human beings. It's like me and you. What would you feel if your life was on the line because something would have been done, but it's not being done? I think those are critical bits that we need to look into. Thank you so much, and back to you, Mariam.
Thank you, Dr. Liambo, for highlighting that. And also something that just came to mind also, especially with regards to cervical cancer. You know, it's one of the cancers that has been marked for elimination for even the next 100 years. And maybe back to you, Dr. Opon, I'm keen to understand if we have been able to, in the past, deal with polio and smallpox. Those are conditions that we do not have to deal with nowadays. And also cervical cancer is also towards that path for elimination. Are there countries that are doing well when it comes to managing cancer? And what can we borrow from their health system models?
Thank you, Mariam, for bringing that up. I think one of the issues that are clear today is that as a country, we have made quite a number of advancements. And remember, I said we are one of the countries actually in Africa with even a cancer care strategy and a registry where we actually monitor what's going on in cancer care. The reason we are able to have this conversation today and highlight that the higher percentages that have in cancer occurring between the ages of 18 to 29 is 25% is because we have a framework, a registry in which we monitor this. So we are doing a lot of advocacy on issues of screening that are going to help us curb or eliminate, for example, as you've highlighted, cervical cancer. There are other instances that we are doing better on. What we are lacking is funding. Countries such as Rwanda, for example, which is not one of the best examples we can give because there are a lot of infrastructural differences. What is done is there are a lot of pilot programs, especially for specific disease programs that are going on, especially with the support of development partners. And that is a reason why we are seeing advanced development in areas of healthcare sector, even in that country. But what we need to actually borrow to bring on board to help us is the dedication of health funding in this country. Remember, I mentioned earlier that since independence, we've been oscillating between 4 to 6% of the national expenditure that is being dedicated towards health. This is an area where we are actually not doing very good. So we need to adopt, we need to make more advances towards dedicating more funding to health. And that is when we will be able to address different disease programs. Because cancer is just one disease program that we are addressing. We have quite a number of others, which basically depend on the minimal percentage of health expenditure that is being allocated to those. So what we can borrow is the willingness to allocate more for funding, and the willingness of the young people to engage more, to take practical initiatives to address this. Today, we are told that among the 5 common cancers that we have, we still have breast cancer leading with the number of deaths. Among women, we have cervical cancer coming, we have the esophagus cancer and colorectal. These are issues that we can actually pick up when we come to areas of accountability and leadership and governance. Remember, we said without a strengthened leadership and governance in this country, we are not going to be able to know which facilities is responsible for what. Even the minimal allocation that we are having in terms of funding, we are not having enough monitoring on how those funds are actually used. So the things that we need to borrow are issues to do with integrity issues, issues with accountability issues. Leadership and governance is something that we're actually missing in this country that can be used to strengthen the health systems to enable us close this care gap. That is the comment I would like to put across regarding that area, Marion. Thank you.
Okay. Anyone else with a comment or question? The floor is open. Anyone with a question? Okay, I think that is fine. Also, just to mention that we recently had a cervical cancer webinar, and in case you missed it, that is uploaded on our YouTube channel. You can go and see the discussions that we had over there. So if we do not have any more questions or comments, I think I'll welcome Dr. David Odhiambo. He's the co-founder for Agriculture, Health and Social Innovation, to speak a little bit. Well, he has touched on the Youth Voices Network. Maybe he could just give us his closing remarks. Then I can head over to Dr. Opon for his closing remarks. Karibu, Dr. Odhiambo.
Thank you, Mariam. And thank you, everyone. So for me, majorly to say thank you for everyone who has been part of this discussion, the engagement, the contributions, and most importantly, the insight that you've gathered from here. As you're moving out of this, the question is, what are you going to do in your own space? And in whatever it is that you're going to do it with excellence, do it with a commitment that at the end of the day, we are making a difference. And that's why for this this Cancer Awareness Day, the campaign that we're having, we had it under the C word, care. Do you care about whatever you're doing, and do you do it with care? Because if you care about something, you'll give it the utmost commitment and the value that it deserves. Do it with love, that is the care. Other than care, you need to do it with a commitment. Do you commit to give it your all, to give it your best, and ensure that we're able to achieve the ultimate outcome that we hope for? And finally, the compassion. That is why I was bringing the aspect on a personal story. This is a human being. This is an individual, a mother, father, sister, daughter, whatever it is, this is an individual. With compassion and care and empathy, and know that it's possible. So how do you do it? And with that, thank you so much for this engagement. Feel free to engage with us and join the Youth Voices Network. Let's work together to shape the future. Marion, can't hear you.
Okay, can you hear me now?
Yes.
Okay, thank you for that. Dr. Opon, I'll welcome you to give your closing remarks.
Thank you, Marion, and thank you, Dr. Odhiambo, for that wonderful message to the young people. I think it's very important that we acknowledge the work that you are already doing on the ground, and your willingness to keep engaging young people so that we can have those contributions on board. Something that I would like to say finally is that we do not actually need to wait for specific dates or specific periods that are normally dedicated for different disease programs. For example, now we are having the World Cancer Day. We have a lot of summits going on. People tend to wait a lot for these specific dates or periods to actually do advocacy. So it's I would like to urge us to consistently talk about these issues. A disease like cancer do not wait for anyone to get to a certain age, or do not wait for anyone to get to a certain point to get that kind of information so that they can be prevented. So let us keep engaging, let us keep talking about this, let's push the word out there. We have said as a young person, even individually, there are issues that we can take up as a person to help in driving this agenda. We say, let us get informed and let us educate other people. We've said, let us get vaccinated, let us encourage our sisters, our friends, let us talk about this in different settings so that we can be able to access, we can let people know where are these services available. Let us get screened regularly so that while you are pushing the agenda of closing the care gap, you know yourself where you stand. You are pushing the agenda based on your reality. So let us engage more. Let us speak about this. Let us not wait for different dates or specific dates so that we can talk about these issues. And I think we will make great steps. Otherwise, I want to thank you, Dr. Odhiambo and Marion, for having this platform. I think the initiative is great. You are engaging quite a number of young people, and this is very important. Let us not lose the direction. Whatever it is you do, whatever little contribution you do, whether you started small, one way or another, your contribution will be noticed. And it is very important when we do this together. We have been informed that you can engage Dr. Odhiambo and the team to get these voices out there through Youth Voices. Thank you very much, Marion and Dr.
Thank you, Dr. Opon, for that. Thank you so much for your recommendations and for the informative session that we've had with you through your presentation. So I think my final points would just to emphasize on what Dr. Odhiambo and Dr. Opon and the rest of us have talked about. That is continuous advocacy and raising awareness. And also let's check our health-seeking behaviors and our lifestyle.